A lot of you are asking about my POTS diagnosis and if it got better or went away with my Lyme treatment. For those of you not familiar with POTS, it's an acronym for Postural Orthostatic Tachycardia Syndrome. It's associated with an abnormal increase in heart rate, tachycardia, upon sitting or standing. However, POTS usually presents with symptoms much more complex than just a simple increase in heart rate. It is fairly common for a POTS patient to experience a drop in blood pressure upon standing as well, though not all patients experience this, and some actually experience an increase in their blood pressure. Some of the symptoms associated with POTS include headache, head pressure, lightheadedness, cognitive issues, brain fog, bradycardia, tachycardia, weakness, a really heavy fatigue, insomnia, shortness of breath or difficulty breathing, excessive thirst, low blood pressure, anxiety, panic attack, nausea, and tinnitus, like this ringing in your ears, right? And then all of the symptoms become worse or exacerbated when upright. POTS can be brought on by a series of things that is often seen in patients with connective tissue disorders, autoimmune disorders, a patient that becomes deconditioned, or a patient that has experienced an infection like a viral or bacterial infection. Because of this last point, Lyme disease patients often get an additional diagnosis of POTS. That was me. Sometimes we see that when a patient gets POTS because of a bacterial or viral infection, their POTS will improve or dissipate once the infection is under control. Though many of my symptoms improved with Lyme treatment, my POTS symptoms became much worse. For nearly 2 years, I rarely left my bed because it was so difficult to be upright. I would black out, and one time I even passed out and broke 2 of my ribs. As this condition became worse, we continued to look for more answers. It was in that search that I came across a doctor who, after viewing my file and spending just a matter of minutes with me, looked up at me and said, "You have Ehlers-Danlos syndrome." I was like, "What?" I had never heard of Ehlers-Danlos syndrome. But she asked me to see a geneticist at the Mayo Clinic, and sure enough, I was diagnosed with hypermobility Ehlers-Danlos syndrome. I'm telling you, many of you might have this genetic disorder and not even know it. And here's the thing, Ehlers-Danlos syndrome is known to have this thing called the trifecta, meaning a pair of 3. It's often seen that patients with Ehlers-Danlos syndrome also have mast cell activation disorder and POTS. And then we were like, yeah, maybe this is why my POTS isn't getting better. Maybe my POTS is more due to this genetic disorder called Ehlers-Danlos syndrome and not so much because of the Lyme disease. But that doesn't seem to be the case either. The other thing that we would learn is that people with connective tissue disorders like Ehlers-Danlos syndrome are prone to cerebrospinal fluid leaks. And a patient with a cerebrospinal fluid leak has very similar symptoms to a patient with POTS. Hence, POTS can be secondary to cerebrospinal fluid leak. I would come to find out that I have several cerebrospinal fluid leaks. And repairing those leaks is what's improving my POTS.